Hello, it's Dr. Rhonda Johnson. Today is Saturday, April 27th, 2024. This is my part 2 message on bird flu. You gotta watch part 1, which I recorded today, also to have the full picture. Now, I talked about an overview. Now I'm going to talk about risks to the public in part 2 and treatment, etc. Now, according to the CDC, as of today, the risk of H5N1 bird flu infection to the general public remains low. That's as of today, because no one knows what this virus is going to do. It is possible that this virus could adapt to spread more easily from animals to people, like it has done among different animal species. Additionally, if it adapts to humans, it is possible that the virus will adapt to spread between people. And we all know that sustained person-to-person spread is needed for a pandemic to occur. Now, as I mentioned in part 1, bird flu has been a pandemic in birds and animals on land and sea, and about 800 plus people have been infected. However, it does have a 53% mortality. Now, there is an occupational exposure risk that for people who have close or prolonged or unprotected exposure to infected birds, cattle, or other animals, or to environments contaminated by infected birds, cattle, or other animals, they're at greater risk of acquiring this. Now, the CDC website has a lot of guidance on their website regarding bird flu. They have occupational protection exposure guidance, for example. So what should you do? Well, we know that unpasteurized or raw milk from sick cattle has tested positive for the virus. So consumption of raw milk can be dangerous and is not recommended according to the CDC. Now, other prevention methods for bird flu that's on the CD website, they recommend cook all your poultry products, including eggs, all the way before eating. Do not eat runny eggs anymore. The CDC also recommends that you cook all beef products thoroughly before eating. Also, the CDC recommends the practice of good hand hygiene. Remember, washing your hands, especially when you cook any uncooked or handle raw beef or poultry. Again, I mentioned the CDC has occupational prevention exposure guidance on their website for people who work with poultry and beef. So what are the clinical symptoms? So for any mild flu-like illness, it's the same: cough, sore throat, fever or feeling feverish, runny nose, fatigue, muscle aches, aches in your bones, headache. You can have conjunctivitis, which is red eye or discharge from the eye. Now, for moderate to severe illness, you can have shortness of breath, difficulty breathing, confusion, alteration of your mental status, or seizures. Now, complication of bird flu includes acute respiratory distress, pneumonia, multi-organ failure, and brain involvement. So treatment. The United States government has confirmed that Tamiflu and other flu antivirals work well in hospitalized patients with severe disease. Now, according to the World Health Organization website, governments around the world have been stockpiling Tamiflu because it minimizes flu symptoms and duration by preventing the virus from escaping into the cells that it affects, and it reduces the likelihood of spreading the virus. So what about vaccines? Well, the United States government is developing a H5N1 bird flu vaccine in case they are needed. Now, it turns out that seasonal flu vaccines do not provide protection against these bird flu viruses. So if you're concerned about this, look at the CDC website. There's all kind of guidance around guidance for clinician, testing guidance, treatment guidance, occupational exposure prevention, public health guidance. I'll include the link. Now, should you be worried? Should you be afraid? I'm not sharing this information to create worry, panic, fear. Viewers have repeatedly asked me to do an update on bird flu. Today is the first time I have addressed this topic. I don't worry because worry and fear do not solve any problems, and I try to avoid both, but I will stay informed. And you can count on me to do updates as we learn more about the situation. And that's my promise. I am not trying to spread misinformation, only facts as I'm able to find them. So take care, folks. And again, this is for information only.